the project. So good luck. Thank you. And I'll hand it back to Brittany.
Thank you, Beth. For those of you that are just joining, my name is Brittany Waring. I am the Health Services Manager here at FactForward. I am going to allow some of my colleagues that's on the call that will be working closely with this project to also introduce themselves, just so you can put a name with the face, and then we'll have you introduce yourself. So I'll just start from who I see first. Avis.
Hello, good afternoon. My name is Avis Wright. I'm the Partner Engagement Manager at FactForward.
Rena.
Hello, Dr. Rena Dixon. I am the Director of Health Services at FactForward, and I will be speaking to you a little bit later.
Jahida.
Hi, I'm Jahida Maldonado, and I am the Health Services Administrative Assistant. I'm sorry, I confused there.
No problem. Jennifer.
Good afternoon, everybody. I'm Jennifer Pozick, and I'm the Research and Evaluation Manager here at FactForward. And also, like Rena said, you'll be hearing from me a little bit later.
Susan.
Hi, I'm Susan Locke. I'm the Partner Engagement Associate at FactForward.
Great. Meredith.
Good afternoon, everyone. My name is Meredith Talford, and I am the Innovation Manager here at FactForward.
Katrina.
Good afternoon, everyone. My name is Katrina James, and I'm the Health Services Coordinator here at FactForward, and you'll also be hearing from me later as well.
Brittany.
Hey, everyone. My name is Brittany Sidnor. I am the Health Communication Specialist here at FactForward.
Great. Doug.
Hey, everybody, this is Doug Taylor. I'm the Director of Community Programs and Evaluation at FactForward.
Great. Did I miss any of my colleagues? All right, so thank you all for joining on today. I am so excited to tell you about an amazing project that my colleagues and I wrote and actually was awarded. But before we go into that, I want to hear more about you. So before I get you all to utilize the chat box, I want you to take out your phones, and I want you to, sorry, I have multiple screens open on my computer, so I apologize. I want to hear more about who we have on the call. And so I like to use what I call Mentimeter, or what's called Mentimeter. And I'm going to share my screen so you can see it. I want you all to tell me what population does your organization serve, but you're going to do it in this. So can you all see my screen?
Yes.
Great. So if you could go to menti.com and use the code 9515217. And I want to know, what population does your organization serve?
I'm sorry, this is Michelle Eric. Can you repeat the code again, please?
Oh, 9515217. Can you all still see my screen? Yes? Okay. All right, so it looks like many of you serve both high school students, college students, as well as parents. See one person serve high school students. All right, so it looks like the majority of you all on the call kind of serve almost college students, high school students, and parents. And then we have some that just service high school students and some that just service college students. So thank you so much for participating. This just allows us to see who we have on the call and what population that you all serve. So in order for me to, for us to know more about you, I would like for you to utilize the chat box and tell me a little bit about you. So your name, what organization that you are from, what organization that you're working with, and what are your expectations as it relates to learning more about this project, if you don't mind sharing that. So if you want to utilize the chat box. So as you tell me your name, tell me what organization you're with. Okay, I see Medicaid, Managed Care Organization, South Carolina State Library, South Carolina Hispanic Outreach, an intern with the Hive, okay. Reproductive Health Service Coordinator at Eau.W.E.R.ed Cooperative Health. Thank you for joining. Richland Library. All right, so while you all are still continuing to introduce yourself, I had some additional colleagues of mine to join the call. And so if I could have, I think I saw Miss Carol, if you could just introduce yourself.
Good evening, good afternoon. My name is Carol Singletary. I am the Outreach and Special Projects Coordinator at FACT-FORWARD. I've been with FACT-FORWARD for 17 years, and I'm the oldest thing there, longevity and age-wise. So, but you know, I'm hanging in there. We try to do a lot of community activities. This month has been really wonderful. We've done a lot of outreach activities, and we really want to expand that. And so we're here to work with you in your community. I do a lot of faith-based work. So if you're interested in that, we can do that for you also. So I'm here to serve. Thank you so much.
Thank you, Miss Carol. Stig?
Hey there, I'm unmuted. Hi, I'm Stig Rasmussen. I've been with FACT-FORWARD for a little over 6 years now. My current role is Operations and HR Manager, and my role on this project is primarily around contracts. So I will be the one drafting all of your contracts, and if any amendments need to be made, any updates or changes from the granting agency that require us to change any of the terms of the contracts, I'll be your contact for that, and working with Brittany and the rest of the team on those issues in case we ever need to make a change to your deliverables during the process to make an amendment.
Great. Alvin?
Good afternoon, everyone. I'm Alvin Kaufman with FACT-FORWARD. I'm the Director of Operations and Communications. I've been with the organization for about the same as Stig, 6 years. And my role here with this project will be to learn from you all, just as with the other organizations at the other sites, to tell the story about what's happening with your project and to learn more about how we can integrate communications to tell the story about the good things that are going to be happening with this program. So I'm happy to be here. Thanks for having me.
Great. I think I saw Denise come on.
Yes, I'm Denise Marcano. I'm the College Health Education Coordinator. I've been with FACT-FORWARD for 4.5 years. My role on this project will be the Capacity Building Specialist for the emP.O.W.E.R.ed program. So anything that has to do with emP.O.W.E.R.ed, I would be the TA for that.
Great, great. So thank you all. I see some amazing people in the chat from all different organizations, and hopefully we'll be able to work with you all. So for those of you that just came on the call, I wanted to go back to, tell you about this opportunity very briefly and to let you see what the title of our project is. So it's titled emP.O.W.E.R.ed SC. emP.O.W.E.R.ed is an acronym for Partners Optimizing Wellness and Education Through Referral, which is the main focus of emP.O.W.E.R.ed SC, creating linkages for youth of color in South Carolina. This initiative was developed to increase the use of sexual health services by youth of color, Black or African American, and Hispanic ages 15 to 19 in 2 counties. And so last week we had a kickoff meeting in Orangeburg. And so this week we're in Richland to tell you about the amazing things as a part of this project. And so these networks will include high schools, historically Black colleges and universities, local health departments. So that will include DHEC and other federally qualified health centers, as well as some community-based organizations that I've seen in the chat box, local businesses, parents, and other youth supporting adults. So I want to take the time to thank you for joining to learn more about the opportunities over the next 3 years for this project. So how did we get here? Now that we've all introduced ourselves to everyone, our thought process for reaching out to partners in Richland County was indeed intentional. As mentioned, when Beth introduced our organization, we invest nearly $1 million annually into communities in our state. And as we are doing this, we are taking the pulse of our state to identify what work or programming is needed. And so because our office is in Richland County, even though we're virtual, we know what is happening in our state. We know what is happening in Richland County. And we feel as though Richland County would have been a really good county to start this work. And so we at FACT-Forward thought it would be a great way to invest federal dollars into communities that were ready to do the work. And so what you're going to hear me talk about for a couple of minutes is to provide you with some data that we collect and use as we were applying for this federal grant. So in 2019, there were 3,425 births to teens ages 15 to 19 in the state of South Carolina. Although this was a 1.8 decrease in the number of teen births from 2018, it is still an issue. And so over the years since the peak in 1991, there has been a 70% decrease in South Carolina. And so we are doing great work with the help of organizations such as yourself, as well as the work that FACT-Forward has been doing over the years. So this averages to about 9 births per day to teens in South Carolina. And so if we had to kind of think about what that looks like, that means a teen in South Carolina gives birth approximately every 154 minutes, just to give you an idea of what 9 births per day look like. So as we were writing, we also take a look at specific populations. And so there are disparities that still exist in teen births. I actually wrote a blog for FACT-Forward. If you would like to check it out, you can visit factforward.org or visit our Facebook page to actually read the blog. But teen birth rates among Black non-Hispanic teens are almost double of white non-Hispanic teens. And the Hispanic teen birth rate is 56% higher than white non-Hispanic teen birth rates. And so this is our motive. This is why we wanted to target this population as we were focusing on this amazing grant opportunity. So just wanted to let you all see the data to show that this is how we get informed. Data is what inform our decisions as to what communities and what counties that we work in. So taking a look at the age distribution of teen births, we see that over 3/4 of teen births in 2019 were to older teens ages 18 to 19. So this is why we also wanted to not only target high schools, but to really work closely with our historically Black colleges and universities in both Richland and Orangeburg counties. So aside from pregnancy rates and birth rates, South Carolina also has an issue, or we see data increase among chlamydia and gonorrhea rates. So teen chlamydia and gonorrhea rates have been increasing in recent years. Our chlamydia rates are higher in teens ages 15 to 19 than gonorrhea rates. And since 2012, teen chlamydia rates have increased by 20% and gonorrhea rates have increased by 40%. And so from 2018 to 2019, there has been a 6% increase in chlamydia rates among teens, while there was a decrease among gonorrhea. So when we are working with the communities, one of our goals is to potentially decrease both birth rates and teen rates, as well as STD and STI rates. Again, when looking at it by race, a disparity still exists among STI rates, where Black teens with their rates being higher than the state rate and nearly 3 times the rate of white and Hispanic teens. And so what you see here is a Richland County, South Carolina profile. We actually have these fact sheets on our website as well. And so you can take a look at it and use it for your resources in your own organization. But this just goes to show you where Richland County rank as far as it relates to teen birth numbers, what the rank is among gonorrhea and chlamydia. So Richland County ranks number 19 out of the 46 counties in South Carolina for gonorrhea, and number 17 out of the 46 counties for chlamydia. So there's work to be done, which is why I'm so glad you all joined us today to learn more about the work that we are proposing or will be doing in Richland County. So as I said, when I first began in March, there was a funding opportunity referred to as Innovation and Impact Network grants that was offered through the Office of Population Affairs. And the application was to ask to establish and support a multidisciplinary network of partners to both develop and test innovative interventions in several priority areas to make an impact on optimal adolescent health, teen pregnancy, and sexually transmitted infections disparities. So based on the data that I just showed you, that was all of what we see in South Carolina, particularly in Richland and Orangeburg counties. So we at FACT-FORWARD decided to write for this grant opportunity and chose the priority area, youth access to and experience with sexual health care. So as you can see on your screen, there were 7 priority areas that we could chose from, and we chose to work on that one. And so this is where we would hope that you all could get involved with us as we're trying to develop and test those innovative interventions that you will hear more about from my colleagues. So we were funded for 3 years, and our year 1 approval of $1.8 million to invest into both Richland and Orangeburg counties. So this is all the other grantees in the United States. And so we were one of 13 to be awarded. And so we are so proud of our work putting into that grant proposal. Some of you on the call may have assisted us with providing us with baseline data and et cetera. And so this just goes to give you a glimpse as to what other work is being done around the country as we're trying to target teen pregnancy prevention in the country. So what is the goal? The overall goal is to create multiple innovative interventions. So if you have a great idea to get young people talking about reproductive and sexual health, if you have a great idea to get parents wanting to normalize that conversation, we need you on this project. And so as I explained earlier, the key priority area is youth access to an experience with reproductive and sexual health care. And we are to establish a multidisciplinary network. So here you all, some of you said that you work with young people, some of you said you work with high school. We want you to create this multidisciplinary network in effort to create these innovative interventions over the next 3 years. So I apologize, it should say Richland County, but what does this investment look like in Orangeburg and Richland County? And so you will hear from Dr. Rena Dixon and Meredith Talford, as well as Denise Mercano and Katrina, as they go into details about what this community investment will look like in Richland County. But for an overarching view, there's 4 main things that we would hope Empowered SC will do. The first is mobilization. We want to mobilize the community to influence the development of innovative strategies to increase access and linkages to sexual health services for youth of color, ages 15 to 21. Next, we want to focus on developing those innovative interventions that I just mentioned. So if you are an organization that want to partner with another organization, you will have the opportunity to explore and develop innovative interventions within the county with the assistance of FACT-Forward. A third component of Empowered SC is implementation. We will implement education interventions designed for high school students, college students, as well as parents and trusted adults in the community. And lastly, we want to evaluate the impact that this investment has on the community. So we're not just going to do all of this work and not see if it has an impact on Richland County. So taking a look at who will be involved in this project, the first group of partners that we have will be college campuses. And so the college campuses that we have being a part will be Claflin University, South Carolina State University, Allen University, and Benedict College. So for the purposes of Richland County, Allen University and Benedict College will be a part of the project. Also, Health Center is at the core of this network. And so the reason Health Center lies at the core is because we would have hoped that by all the innovative interventions that will be developed over the 3 years, that young people will go to the health centers to receive services for both sexual and reproductive health. And those health centers that we will includes Richland DHEC, Orangeburg DHEC, and Eau-Claire Cooperative Health Centers. So I don't know if you're familiar with Richland County like in detail, but Richland DHEC and Eau-Claire Cooperative Health Centers are within walking distance of Allen University and Benedict College. And we not only want to serve college students, but we do want to serve high school students as well. And so although we do not have a direct partnership with Richland County School District, both Richland 1 or Richland 2, if you are a community organization that has access to those students, we would like to partner with you to do some programming or to create some of these innovations. And so this is where you come into play with community partners. And so we have TBD for community partners because we at FACT-Forward, we don't want to just go into the community and demand what it is that we want you to do, but we want to hear from you all as to what works well in your county, in your community. And so hopefully by the end of this call, we will have identified some of those community partners that we can work closely with the help of a community advisory group. And so the community advisory group will be both convene in Richland and Orangeburg County separately with possibility of meeting together, where you all will kind of advise the work that's going on in the community as it pertains to this work that we're doing. And then lastly, you see community health worker here. So each health center that's on the project has hired or will hire a community health worker that will work strictly with the work that's being done with Empowered SC, with hopes that we would all have increased access to the health center and students receiving both sexual and reproductive health services. So you will now hear from Meredith Talford, our innovation manager, as she speaks to you all about mobilization and the community advisory group.
Next slide. So how's everybody doing out there? I'm so excited about all the people on this call. I'm going to talk to you all about community mobilization and the community advisory group. So a lot of you all are probably on several groups to address several social determinants. But today I'm going to talk to you all about, how community mobilization is seen as the foundation of any type of long-term change. For this specific project, the Community Advisory Group is the main source of stakeholder engagement. We intentionally use the word advisory because you know your community. I know my community, you know your community. And we want you all to kind of serve as the thermometer, but also the thermostat when it comes to reproductive health services and accessing reproductive health services. Something popped up on my computer in Richland County. And it's because, there's a lot of best practices out there and a lot of little pockets is doing, but when you come together, that's when the real impact happens. So, next slide, thank you. So the Community Advisory Group, the work that we're going to do will be informed by collective impact. So, if you are familiar with collective impact, it starts with a shared vision, but we also want to focus on that shared accountability. It's great to come together. It's great to throw out all these ideas, but we all have to be accountable for the work that needs to be done in this community. Much of this group's time will be spent thinking about innovation. So you will guide those innovative strategies, and Dr. Dixon will talk about a lot of that later. But we want you all to say, you know what? I think that will be great in this community. But we also want you to be vocal to say, okay, let's take a step back and think a little more about that. You all will be essential working with Brittany to develop those communication messages and for your young people, as well as the parents and everyone else in the community. Like I said, you know your community. You know what messages will go over well, but you also know what messages will not go over well, or some of the things that have happened in the past. We need you to tell us that information. You all will also participate in something called a social network analysis. In simple terms, that's when we investigate processes of social structures and then what links them together. In addition to the representative from the community partner and college campuses, the richness of this program is going to come from engaging young people, engaging faith community. I think I saw Triumph Church on here, so we're happy to see you here. We would love to have you at the table. Think about those business owners, Parks and Rec, we need you at the table, and young people at the table. Think about those people in the community that don't have a formal title, but they are change agents and they are influencers around Richland County. That's who we want to bring to the table. So Brittany will talk about what all of that looks like later. And that's what I have for community mobilization. If you have questions, put them in the chat box. And now I'm going to hand the microphone over to Rena Dixon.
Thank you, Meredith. I just want to welcome everybody again and just reiterate that we're very excited about working with you on this project. We work all over the state, but very rarely do we actually get to do work in Richland County. So I think all of the staff are actually really pumped to be able to dig into a lot of the organizations that do work here, because we're used to traveling all around and not do work in our own backyard. So as Brittany explained, the crux of this project is innovation. So this is not one of the typical projects where you just have to replicate something and be boring. We actually get to flex our creative muscles throughout this project and come up with new and different ideas to serve our young people, to make sure that they're going to actually get to a health center to receive services. Next slide. So what we've come up with is a concept to where we can serve young people through different avenues. As part of the requirements of this grant, we are required to give out 50% of our award funding to the community. So we're going to be giving out $875,000 across Richland and Orangeburg counties every year for the next 3 years. So we want you to be a part of that. There are going to be several different ways that you can be involved in receiving this grant funding. The first is our program partners. So Brittany mentioned DHEC, mentioned our college campuses. We have our Orangeburg County School District. They're going to be participating in our Learning Collaborative, which we affectionately call CREW, which stands for Collaborative for Reproductive Education and Wellness. And there we're going to be teaching quality improvement principles and how do you apply that to testing these innovations that we're going to come up in your designated setting. Now we're also going to have community implementation partners. So let's say that you have a group of young people that you see regularly and you have a program that you want to try out, you have an idea that you want to test out, and you want to meet with those young people consistently over an amount of time, you're going to be able to apply for a community implementation grant. Innovative partners, we're going to require a little bit more than you. Now, let's say you have an idea that's been brewing in your head, you really want to work it out, but you haven't had the time or the funding to be able to do that. We're going to offer you funding to go through a design thinking process and then participate in our learning collaborative to get your idea off the ground. Meredith has been calling it Shark Tank. So we kind of thinking about how do we come up with those ideas that you just can't quite figure out how to implement. We're going to be here to help you do that through the innovation partner funding. And then community sponsorships are going to be available to help people that want to do more one-shot awareness events. Maybe you don't have the capacity to do an ongoing program and you just really want to do a couple of one-shot things at your church or your community center. That's what community sponsorships are for. We've been doing those for a very, very long time through some other funding available across the state. But this is an opportunity for Richland and Orangeburg to increase the amount of awareness events going on and funnel the information about sexual health care services to young people. So those are our 4 buckets of funding. We are going to be releasing a funding application in the next couple of weeks for a couple different one of these, but the staff are more than happy to talk to you if you're not sure which funding strategy you want to apply for or what the level of work entails for each one. But we are here to help you through that process, and you will have technical assistance training and all kinds of fun things available through whichever level of commitment that you want to apply for. And I am going to pass it to Katrina.
Awesome. Thank you, Rena. Next slide, please, Brittany. Thanks. All right. Good afternoon, everyone. I know I introduced myself earlier, but for those of you who hopped on a little bit later, I'm going to reintroduce myself. My name is Katrina James. I'm the Health Services Coordinator here at FACT-Forward. My primary role with this grant project is to provide technical assistance and capacity building for those partners that we're working with, and as you saw on the previous slide as well. Next slide, please. Okay, so to give you a kind of a visual overview, this is a stakeholder map and collaboration structure to show you who is involved in this project and how those moving parts will be connected, because there's a lot of moving parts to it. So we have each employee from FACT-Forward in their respective roles, and each section is connected to a partner that we'll work with. And that's how we'll move those needs to each other. So specifically like in these high need areas with high schools, colleges, things like that. So when we work with individuals from these specific groups, we'll have them from community action groups, as you can see, to peer educators, to community health workers working in the health centers and health departments. We'll be working with telehealth and direct services to colleges, high schools, and communities with parents and caregivers, all working with emP.O.W.E.R.ed, which will be discussed a little bit later. We'll also do those innovative ideas that Rena and Meredith talked about, and we'll be using those to engage our youth. Each of these groups are important to reach our youth. So if you kind of notice near to the bottom, we have a section for ride share. That's something we're also going to be working on implementing. And what I'll show you in the next slide is a description of how we plan to implement these interventions with these partners. And so we plan on working with implementing and testing emP.O.W.E.R.ed High School, and that's to determine if program participation leads to an increase in the number of youth of color who access sexual health services post-completion, and if this program could potentially be scaled up to meet the minimum requirements of the South Carolina Comprehensive Health Education Act. The next we want to do is implement and test emP.O.W.E.R.ed College, and that's a program that we want to do within HBCUs to determine if program participation leads to an increase in the number of youth of color ages 18 to 19 who access sexual health services post-completion. The next one we want to do is implement and test emP.O.W.E.R.ed Parents, and that program is to determine if program participation leads to an increase in the number of parents who discuss sexual health with their youth. We also want to develop, test, and refine a peer education training curriculum to utilize high school and college students to facilitate access and linkage to sexual health services. And as I said before, we want to implement, test, and refine the utilization of a community health worker. And we want them to identify youth of color, sexual health, and other identified needs. Community health workers will utilize something called the Rapid Assessment for Adolescent Preventive Services, and it's called RAPS. And that's going to facilitate linkage and access to sexual health services at Title X clinics and or FQHCs, federally qualified health centers. We want to develop, implement, and test telehealth coaching and telehealth services for youth within those clinical settings at our health centers and our health departments. So through all of these interventions, we plan to implement. Our overall goal is to have an impact on optimal adolescent health, teen pregnancy, and STI rate disparities. And if you do have any questions, I will list my email in the chat. But next up, we'll have Denise, and what she's going to do is give you an explanation on what media-aware is. I know I gave a brief description of it, but she'll go a little bit more in depth and what media-aware is for the colleges, high schools, and parents and caregivers in the community. So up next, Denise.
You're on mute, Denise.
Thank you. Like I said before, my name is Denise Marcano. I'm the College Health Education Coordinator. On a previous grant that we're currently working on, we are actually implementing Media-Aware College, and we thought it would be a good fit for this program that hopefully you guys are going to be implementing. So with the Media-Aware College program, it's an online program that covers birth control methods, sexual assault and consent, alcohol and substance use, and risky sexual activity, STI prevention and testing, bystander intervention, stalking, dating violence, and abusive relationship. It also covers gender role stereotypes, effective communication with romantic partners and health professionals, and it uses media portrayals of romantic relationships. As far as the Media-Aware High School program, it covers similar topics as well, which is age appropriate. And then with the Media-Aware Parent program, it's basically for caregivers or parents where they can choose which topic they want to get resources and more information on so that it gives them a foundation to have these conversations with the youth in their life. The Media-Aware Parent program also has components that the adult can actually do with the young person if they choose to. If anyone is interested in reviewing any of the 3 Media-Aware programs, please reach out to Brittany Waring. You can see her email address at the end of the presentation, and then we can send you a login for a review. And I want to say next would be Jennifer Prozic talking about evaluation.
So before Jennifer comes up, Denise will also be someone that you can contact. And so she will provide her contact information in the chat. As Rena mentioned before, Media-Aware is one of those curriculums, like if you are an organization that works closely with young people and you want to implement Media-Aware, this is an opportunity that you can possibly participate in, where we could provide you with a mini grant for you all to implement Media-Aware with both young people and parents, if that's something that you're interested in. But we'll hear more from you all later. So next we'll have Jennifer and Randy to give us some information on how we will evaluate the impact of all of these great interventions.
Good afternoon, everybody. I just want to, again, like everybody else has kind of done since some new people have joined, I'm Jennifer Prozic. I'm the research and evaluation manager here at FACT-Forward. And primarily on this project, Brittany, if you want to go to the next slide, Evis. So internally, we have a large deal that we will be taking care of as far as data collection. We have, as Katrina, Rena, and Denise has just described, we'll be responsible for collecting information on the Media-Aware High School program, college program, and parent program. So with all of those programs, we'll be developing data collection tools and tracking, and then monitoring those outcomes over time. So through the Media-Aware High School program throughout Orangeburg and Richland, we intend to reach about 4,000 students and then about 800 parents through Media-Aware currently. So we'll be doing a lot of data collection And then we'll also be working with the clinics to develop data collection tools, tracking and monitoring again of monthly clinic measures. So for people that have worked with some of our projects that FACT-Forward has funded, we have done some data workbooks around like looking at the number of sexual health visits, the number of STI tests performed, things like that. So we'll be looking at who's actually accessing services and other things like contraceptive devices and things like that to make sure that we're actually measuring to see if there's an increase in those who actually access sexual health services. And we'll also be working with, as Rena described, all the innovations that could be potentially applied for. So we'll also develop evaluation tools and help community partners develop any data collection tools that we might need as part of the evaluation for any new innovations that are proposed through the different community partners. Internally, we'll also, anybody that receives grant funding usually know there's funding requirements as far as what we're responsible for reporting semi-annual performance measures to the Office of Population Affairs. So those are things like the number of youth that have been reached, how many people have received training and things like that. And lastly, we're working with Phil.E.W.E.R.ed Research and Evaluation, who is serving as our external evaluator for the project. And we will be sharing all of our data with them, and also working with them to refine our tools and things like that. But I'm going to turn over to Randy, who is with Phil.E.W.E.R.ed, and she's going to kind of tell you a little bit more about her role in the project and some upcoming activities that we'll have planned.
Hello, everybody. My name is Randy Berlew, and I'm a senior associate with Phil.E.W.E.R.ed Research and Evaluation. And we're really excited to be supporting this work as the external evaluator for the project. And the purpose of that is really to do a couple of things. One, to work to provide timely information to help drive the innovation. So we'll be working on some things that I'm going to talk about in a second that will be shared with the community advisory group, which will hopefully be useful in helping to decide what types of innovations are appropriate for the community. We'll also be working on some of the evaluation work with Jennifer and her team to help tell the story of the impact of this project on the community. So as Jennifer said, part of what we'll be doing is consulting with FACT-Forward and assisting with some of the evaluation work that they're doing internally and collaborating on refining and designing evaluation tools. Our first big task that we're ramping up right now is a community survey where we are going to be doing two things. First, we're going to be reaching out to parents and their children in your community and asking them to give us information about their perceptions of the needs and gaps around adolescent reproductive health. And hopefully that'll give some real-time information about what youth and parents think are the real important needs in the community. We're also going to be working with some of the health centers as a part of this as well to collect some data from people who are coming for appointments to understand what drives people to come have services and what might some of the barriers to receiving services be. The next thing that we're going to be working on, and it's coming up very quickly, is a social network analysis. As many of the FACT-Forward staff have talked about before, a big part of this project is gathering community partners to work together collaboratively to drive forward the work that's going to be done in the community. And one of the things that we'll be looking at in the social network analysis is how working together in this collaborative fashion strengthens relationships between organizations, hopefully in a way that lasts past the grant funding. And so we'll be looking at how those relationships evolve over time, how collaborations are formed between partners, and what the impact of all of these partners working together is on the work of the grant. We'll also be doing some data analysis for the Tier 2 innovations. A big part of this grant is identifying innovations, testing them out, and then we'll be helping with looking at the data to talk about what's working and why it's working in the community. And then we'll also be helping, as I said, to tell the story of the project through data. So we'll be working collaboratively with the FACT-Forward team to develop reports and summarize everything that's learned over the course of the project. So thank you, and I'm looking forward to getting to know more of you over time.
Thank you, Randy. So you've heard about the mobilization, you've heard about the innovation, the implementation, and the evaluation. And so now I want to hear from you. And what are your thoughts of this grant opportunity? So I'm gonna need you to take out your phones again. And I'm gonna share my screen. And I want you to tell me, what impact do you think Empowered SC will have on the community as it pertains to Richland County? And so you will go to menti.com and use the code 9515217. And I want you to tell me, after hearing about the mobilization, the innovation, the implementation, and the evaluation, what impact do you think Empower SC will have on youth of color in Richland County? So that code again is 9515217, and you will go to menti, menti.com. And can you all see my screen? Great. So it doesn't have to be a whole sentence. It can be a word, but what impact do you think? All right, so I see collaboration, increased awareness, access to education, inform community resources, education, engagement, trainings, lower rates, lasting, fun. Yes, absolutely. Although it sounds like a lot, we want to have fun at the same time. Parent involvement, lower STDs, lower rates, prevention. Anything else? All right, I think, nope. Something else just came in. I'm trying to see, what was it? Engagement. All right, so we see some different things that we would hope that Empowered SC would have an impact on in the community. And I actually will keep this as a reminder as we're going through the next 3 years of this project, to remind us of what some of the things that we're looking forward to as we're working within your community. What I also want to do is, if you wouldn't mind, some of you sharing your thoughts about what you've heard, if you want to provide that in the chat, or unmute yourself to tell us, is this something that you can see your organization being a part of, or is it someone else that should have been at this table that's not here? I would love to hear from you. So if you want to unmute yourselves to tell me, do you see yourself working with this project and in what capacity? Or if you would like to provide that in the chat for me, that would be great. Do I have anybody that wants to unmute themselves?
Hi, can you hear me okay?
Yes.
Okay, I have trouble with the mic sometimes. But my name is Kyla Capers. I'm with the South Carolina Department of Consumer Affairs. And what we do is we serve all of South Carolina. And one of the things that we do is educate everyone on consumer related topics. We do partner with a few different organizations, and we have a lot of youth partnerships as well. So a lot of times we go into schools, and we talk about social media smarts, being safe online, the dangers of sexting, what that can, what kind of trouble you can get in, what kind of career, like what kind of damage you can do to your future career or education, just posting the wrong thing or retweeting the wrong thing, things like that. We also educate on financial literacy topics, and credit as well. So I definitely think that this would be a good organization for us to be involved in anyway. We have um, a lot of free resources that we can provide as well, as far as publications. We're here to just serve as a resource for South Carolina residents in general. So I definitely think that this is a good program that we can get involved with.
Great. Thank you for sharing. And what organization did you say you were with?
I'm with the Department of Consumer Affairs.
Okay, Department of Consumer Affairs. Thank you. Anyone else? So I see someone in the chat thank us for the allowing the opportunity for the faith community. So yes, if faith communities have an idea to, I don't know, involve parents, and you all want to create an innovation around parents, this is an opportunity for you all. And so after hearing about all of the great things that we mentioned so far, who should be on this call that was not? I would really like for you to drop down agencies or organizations using the chat box. Or do you see yourself playing a role in the project, and what role do you see yourself playing? And so there's several roles as we talked about the complexity of this project. Are you a pioneer? Do you redefine problems to break boundaries? Are you an ideator? Do you generate many ideas and may not see them through development? Maybe you want to go through our design thinking cohort. Are you a connector? Are you that person that people that see things differently and can translate wild ideas? Are you a creativity partner who can develop or refine ideas early on? Are you a key stakeholder in Richland County? Those are the people that can affect or be affected. Are you a sponsor? Do you have the power and the ability to allocate funds and or resources? And are you a builder? Someone that can build prototypes using directions. So these are the people that we're looking for to work with us over the next 3 years. And you don't have to work with us in the 3 years of its entirety. If you want to possibly start out year one, just getting a sponsorship, as Rena mentioned before, to host an awareness event. And then from that awareness event, you got an idea about what it is that you want to work on. And then you want to go through the design thinking cohort. Are you, I think Meredith mentioned earlier, someone from Parks and Rec on here. You have access to many young people. Do you see yourself or your organization implementing media-aware, perhaps through a summer program? It is online, so if you're worried about, COVID practices, the students can access it online, and we can provide funds for you to offer incentives for them completing that along with surveys. Are you an organization that had this idea, but you didn't have the guidance or the funds to test the idea? We would love to have you on board. And so these are the things that we will be working on in Richland County over the next 3 years. One thing that we didn't go into detail about, but in each county, we will convene not only a community advisory group, but peer educators. And we would like for our peer educators to both be high school students and college students. We do know that peers learn and they take information from other peers. And so if you have a group of peers that you say, you know what, I think that this would be a great thing for some peers in Richland County to be a part of, drop your contact information in the chat. We would love to connect with you. And so next, I want you to some next steps is to, after hearing all of this, I know this was a lot of information, but maybe go home and talk to your other colleagues, talk to your network. And if you have an idea that you put on the shelf, or that idea that you were like, oh my God, I did not know if this could work, this is the opportunity for you. You can connect with us, or you can put in the chat box, I have an idea, and someone can follow up with you. You can also contact me directly if you're interested in looking at the media aware curriculum to see if this is something that the people that you serve, not only young people, but there is a media aware parents. If you want to review that to see if this is something that you can possibly implement, you can reach out to Denise Mercano. She included her information in the contact box, in the chat box, or you can reach out to me directly. So I wanted to provide you with some what's going to happen next. So this is like a brief timeline. So in July, we were funded with hopes of being funded until 2023. With the funding, we were given 6 months of planning. So all of the great things that you've heard, we're in the process of still planning. And so that ends in December. We would hope to begin implementation in January. And when I say implementation, this is when we will potentially convene the community advisory group. So perhaps you don't want to implement, but you still want to be involved and you want to sit on the community advisory group. You can reach out to us to say, hey, I want to sit on the Richland County Community Advisory Group, and we can give you that information. If you're interested in being a part of our design thinking cohort, as Rena explained earlier, we'll have applications go out and we would hopefully begin that in January. We will begin our peer educator training in March in both counties. And so if you have a young person that's interested in reproductive health or sexual health, or just wanting to be a leader amongst their peers in Richland County, we would love to have them sit as a peer educator for both on the collegiate level or high school. And so that training will begin in March, and we will have additional trainings throughout the year. We are considering our COVID guidelines, and so a lot of these events that you see on the screen will be held virtually until we learn more about how we can begin to convene in person again. The crew learning session begins in April, and so that's the learning collaborative that Rena mentioned, where we will bring both networks from both Orangeburg and Richland together to hear about what is it that they're working on. What are some of the ideas that they want to test as we try to increase youth access to an experience with sexual and reproductive health care. Also, we have an annual Summer Institute conference that will be held in June. If you're interested in attending that, you can always visit our website where we have amazing sessions from presenters across the country as it pertains to advancing reproductive health, teen pregnancy prevention, and an array of other topics. And so that concludes our presentation today, but I wanted to make sure that I stopped to answer any questions anyone may have. You heard about a lot of opportunities. You heard Rena say we have $875,000 to invest into both Richland and Orangeburg counties. So do we have any questions about the work that we've explained and can't wait to get started in January? You can either unmute yourself or you can type your questions in the chat box and we can answer. Okay, so no questions. We also want you to make sure that you stay up to date on what we do. So as I said before, I shared with you some fact sheets. I shared with you some statistics, even some trainings that we've had or upcoming trainings that we have coming up. You can visit us at FACT.FORWARD to learn more about all of those events. You can also follow us on Facebook, Twitter, and Instagram at FACT.FORWARD.org for some amazing Let's Talk videos or interviews. October is Let's Talk month for us at FACT.FORWARD, where we use this time to encourage positive talk among parents or trusted adults with young people as it relates to love, sex, and relationships and other sensitive topics. So feel free to visit our page and watch some of those interviews. And if you are wanting more information, we are going to take your information from the chat box. But if you want to contact me directly to say, you know, I heard what you said and I want to apply for sponsorships, you can reach me. My number is 960-1525 for those of you that are joining by phone and can't see the screen. Or you can email me at bwearing, that's BWEARING at FACTForward.org, and I will be sure to contact you back. as soon as I can. But before you get off the call, I would love for you to complete this survey. As our lovely evaluation staff have said, we always like to evaluate everything that we do because we know that evaluation and data informs decisions and informs how we will meet with you again. So if you could either use your phone and take a picture of this box, or you can go to the link surveymonkey.com/r/tier 2 community kickoff. I would really appreciate it if you could take the survey. If I can get one of my colleagues to paste the link into the chat, that will be great so people can just click on it as well. And so I'll stay on here for about 5 minutes just in case you all have any questions and some of you are shy and just want to talk, behind the scenes. I'll stay on. If not, I can't wait to hear from you. I see a lot of people are engaging in the chat box saying that they are interested. And so we will make sure that we follow up. Any questions from anyone? I'll put the slide back up. I do apologize. Where did it go? All right. All right. Well, if there are no more questions, you all have an amazing, what's today? Tuesday. And hopefully I'll be in talks with you all soon. Have a great day. Bye. And if anyone has any questions, I'll stay on to answer any questions you may have.
Brittany, please don't hang up. I'm chatting with someone.
All right. If no one else has any questions, I guess everyone can go about their day and we'll be in touch. I will stay on, Meredith, because you are still chatting though. Is there anyone else on the call that have a question that they want to chat with me directly with, or you can unmute yourself?
Thanks, Brittany.
You're welcome. All right. Well, everyone have a great day.
Brittany.
Yes.
Don't exit the Menti window. My internet was in and out and I wasn't able to screenshot. I'm sorry.
No
the one
problem.
I got, Lydia said she can't use.
No problem.